Hi, nice to meet you, sir. My name is Dr. Srinivasan. How are you feeling today?
Well, Doc, I feel pretty good most of the time, but every once in a while for the last 3 months, I think when I kind of like turn and do something on this side, I get this crazy sensation of the room spinning, and it keeps happening.
Huh, room spinning, huh? How long has this been going on?
I would say 3 to 6 months. The first time I thought, oh, maybe I just needed to eat or, take a nap or I was tired, but it keeps happening.
Okay, and only when you turn to that right side.
I think so. I haven't really been paying attention, but
Okay.
I feel like when I turn this way, like if I'm in the kitchen and I go around the corner, sometimes it happens then, and we have this like sharp right corner in the kitchen. I don't know. I just can't figure it out.
Okay. How about when you go to the left side?
I haven't really noticed it that way, but I'm not a doctor. I haven't been paying that much attention.
Sure, absolutely. Any nausea or vomiting associated?
I get a little nauseated, but I haven't thrown up yet.
Okay. Any fevers, chills, or night sweats recently?
Not that I've noticed.
Okay. How about any changes to your hearing? Do you feel like you're hearing okay?
No, my hearing seems to be fine.
Okay, great. Any headaches?
Sometimes I get headaches. Yeah, I get headaches pretty regularly, but I haven't really noticed that the spinning and the headaches go together, to be honest.
Okay, all right. Any history of recent travel? Been flying on planes?
No, I haven't gone anywhere in about 6 months.
Okay, great. Well, it sounds like you're having some symptoms of what we call vertigo, which is that sensation of movement when you're not actually moving.
That's what my sister said. She's a nurse, and she said I had vertigo.
She's absolutely correct. So what we're going to do is a series of maneuvers to see if we can figure out whether your vertigo is coming from inside your brain or somewhere in the periphery.
Could it be a brain tumor?
It's quite unlikely to be a brain tumor. Based on what you're describing, it sounds a lot more like benign paroxysmal positional vertigo, or BPPV.
Benign sounds good.
Yeah, benign's a good sounding word. It's basically a fancy way of saying that there might be a stone in the canals in your ear that basically makes you feel like you're moving when you're not. So your ears are filled with these fluid canals that have movement, and based on how you're moving, your ears can tell your brain, I'm turning my head to the right, or I'm turning my head to the left. And if there's a stone in there, it'll basically trick your brain into thinking that you're moving when you're not. And so when you turn your head, you're going to get this dizziness sensation because your brain thinks you're spinning around in a circle. Does that make sense?
Yeah, kind of.
All right, so we're going to try something called the Dix-Hallpike maneuver today. So what we're going to do is hopefully try and reproduce your symptoms. Bear with me, it'll only last for a little bit of time. And then we're going to move right into a maneuver that'll hopefully move that stone out of that canal, back where it's supposed to be. Hopefully that'll make you feel better.
Great.
Does that sound okay with you?
It does.
All right, let's break. Have you do is turn your head about 45 degrees to your right, and then I'm going to bring you back slowly, okay? And keep your head turned to the right. Keep your head turned to the right. Great. And I'm going to drop your head below the parallel. And what I'm doing is looking at your eyes. And yep, you're seeing that. Are you feeling that dizziness?
Yeah, I'm so dizzy.
What I'm doing is looking at your eyes and seeing some beating movements.
Yeah, I don't feel so good.
All right, well, let's bring you back up. All right, feel better?
Yeah, a little bit.
Great. All right, so what we're going to do is go right into a maneuver that we're going to start with that same position. We're going to hold it there for about 30 seconds.
Okay.
30 seconds, maybe 2 minutes. Eventually your symptoms should subside. And then what we're going to do is do a maneuver where you should hopefully correct where that stone goes. Okay?
Sounds good.
All right. So let's start again. Head turned to your right. Perfect. Come on back. Drop your head down. And then now you're starting to feel dizzy.
Yeah.
See those eyes going.
I don't feel so good.
Feeling all right? A little nauseous? Bear with us.
A little bit.
All right. Should start going away pretty soon. All right. Feeling okay?
Yeah.
Good. All right, so what I want you to do, slowly turn your head to the left, keep your head down, relaxed. Great. Okay. Now what I want you to do is turn onto your left side, keeping your head down, and turning your head all the way to the left. Great. Now I'm going to have you sit back up in this exact position up on the side. Alright, now you can raise up your head and look straight.
Oh,
How do you feel?
I feel so much better, Doc. Thanks.